UroPatient. Tune in and see. Prepare your health for you and me. Knowledge is power. We make it clear every Saturday morning.
Hey, good morning and welcome to UroPatient Podcast. I'm your host, Vic Senese. Glad to have you on board. If this is your first time checking us out, be sure to like and subscribe. It really helps our algorithm to have more people see us. So be sure to help us out. Hey, today, an elevated PSA test result can be alarming, but it does not automatically mean you have prostate cancer. In fact, many conditions, including an enlarged prostate, infection, inflammation, or even recent exercise or ejaculation, can temporarily raise PSA levels. Today, I'm going to explain what an elevated PSA really means, what additional tests your healthcare provider may recommend, and how modern tools like MRI and biomarkers are helping reduce unnecessary biopsies while improving cancer detection. So let's get started. You're here, you or a loved one might have recently received a blood test showing an elevated PSA. For many, that news feels like an immediate cancer diagnosis. Today, we're going to look at why that's not necessarily the case, what PSA actually is, and the step-by-step process your doctor will use to find out what's really going on. Main message today, don't panic. So think of PSA like a smoke alarm in your house. It tells you there's smoke, but it doesn't tell you if there's a major fire or if you just burnt some toast in the kitchen. Now, PSA is a protein made by your prostate, and while it's normal for some to leak into the blood, higher levels mean the prostate is irritated, inflamed, or enlarged. While 4.0 is the traditional cutoff, your normal might be different based on your age and the size of your prostate. It is statistically more likely that your elevated PSA is caused by something other than cancer. In the 4 to 10 gray zone, 75% of men, now did you hear that? 75% of men do not have cancer. Even if cancer is present, it often grows slowly, allowing us to take a breath and perform a thorough evaluation rather than rushing into biopsy. The two biggest non-cancerous culprits are BPH and prostatitis. BPH is just the natural enlargement of the prostate as you age. More tissue means more PSA. Now, prostatitis is inflammation, often from an infection, which can cause PSA to skyrocket temporarily until treated as such things as antibiotics. Our PSA is sensitive. Things as simple as a long bike ride or sexual activity in the 2 days before your blood draw can artificially inflate your numbers. That's why the first thing your doctor will likely suggest is simply waiting a few weeks and repeat the test. Now, black men face a higher risk of developing prostate cancer and are more likely to be diagnosed at a younger age. And typically, there's a greater chance of developing an aggressive disease compared with men of other racial groups. While the exact reasons are not fully understood, genetics, family history, access to health care, and social factors all play a role. The good news is that prostate cancer found early is often treatable. Black men should talk to their healthcare provider about personal risk and whether to begin prostate cancer screening, including a PSA blood test, earlier and possibly a digital rectal exam, especially if they have a family history of prostate cancer. Staying informed and keeping up with regular medical care can help detect problems early and improve outcomes. Now, we don't act on a single number. We repeat the test, often asking you to avoid those temporary triggers we mentioned, bike riding, sex, that type of thing. Your doctor will also perform a DRE, digital rectal exam. While nobody looks forward to it, it's a vital 10-second check to see if the gland feels smooth or if there are hot spots that blood tests can't see. If your total PSA is in the gray zone, we can look at a free PSA. Think of total PSA as the mail in your box. Free PSA are the postcards without envelopes. Cancer cells tend to produce PSA that is bound in those envelopes. So, if most of your PSA is free, like those postcards, It's a reassuring sign that your elevation is most likely benign, such as BPH. Next is PSA density. So what's that? We divide your PSA score by the size of your prostate. Typically, that's measured by either an ultrasound or an MRI. If you have a huge prostate and a PSA of 5, your density is low, which is reassuring. But if you have a very small prostate and a PSA of 5, that's a high density, which raises more concern because there isn't enough normal tissue to explain that number. Now, doctors don't just look at the number, they look at the velocity or trend. So that's why it's important to get yearly testing starting early. A PSA of 4.0 that has been 4.0 for 3 years is much less concerning than a PSA that was 1 last year and 4 today. However, guidelines say velocity should never be the only reason for a biopsy. It's just one piece of the puzzle. I really like the synthesis matrix to help you make sense of your results. So if your free PSA is high, greater than 25%, watching makes sense. However, if it's low, less than 10%, that should be a red flag. PSA density, where we compare the size of your prostate with your PSA, if that number is less than 0.15, it's okay to watch and wait for a while. However, if it's greater than 0.15, that could be a warning sign. And finally, PSA velocity, which again shows how fast it's rising. If it's going slow, most likely just due to enlargement of your prostate. However, if we're seeing a rapid rise, greater than 0.75 nanograms per year, then we need to look into this. Remember, these are only guidelines and it does not substitute for a discussion with your physician regarding your next steps. So remember, we don't act on a single number. Repeating the test, DRE, all those things we've talked about. But before jumping to a biopsy, many doctors are now ordering something called a prostate MRI. This gives us a detailed look inside the gland. If the MRI is clear and your other markers are okay, as we talked about, we might just continue to monitor you. If it shows a hot spot, it tells the urologist exactly where to aim during a biopsy, making the procedure much more accurate. If your risk remains high after all these tests, a biopsy is truly the only way to definitively diagnose cancer. Now, the good news, it's a 10 to 15 minute outpatient procedure. You'll be receiving a local numbing agent, and the doctor will use the ultrasound probe to guide a thin needle to take about 12 small samples. Most men find the anticipation worse than the actual discomfort. Now, I've been involved with prostate biopsy my whole career, helping assist with those in the ultrasound side of it. And I can tell you that most patients, after they've had their biopsy, have told me this wasn't as bad as I thought it was going to be. I think the whole key is talking them through it, getting them kind of to relax and not be so nervous about it makes a big difference. And I've had a few patients say, you made it a lot easier for me. Now, MRI fusion biopsy is an advanced procedure that combines detailed MRI images of the prostate with real-time ultrasound guidance to help your healthcare provider target suspicious areas more accurately during the biopsy. This approach can improve the detection of clinically significant prostate cancers while reducing the chance of missing important tumors and may decrease the need for repeat biopsies. The procedure is typically performed with local anesthesia and involves taking small tissue samples from both MRI-identified targets, and we still do those standard areas that we like to check on the prostate. Now, most men tolerate biopsy well, but temporary side effects are common. You may notice blood in your urine for several days, blood in your stool for a short time, or blood in your semen. Now, that can last several weeks and even months. All harmless, gradually clears on its own. Some mild soreness or discomfort in the biopsy area is also common and can often be managed with over-the-counter pain relievers recommended by your healthcare providers. Less commonly, men may experience difficulty urinating or develop an infection despite preventative antibiotics. Talk to your doctor or healthcare provider immediately to seek urgent medical care if you develop a fever. I say anything over 100, you should towel them. Chills, severe pain, heavy bleeding, or unable to urinate, as these symptoms do require prompt treatment. Now, the results will take about 10 days. Benign means no cancer. That's what we're all hoping for. That's good news. If cancer is found, it's given a Gleason score. to show how aggressive it looks. A score of 6 is considered low risk. We talked about that earlier. In many of these cases, we don't even treat it with surgery or radiation. We just use active surveillance, which means we just keep a very close eye on it. So to wrap it up, don't panic. Ask your doctor what the exact PSA number is and how it has changed over time. Be honest about any recent triggers like a UTI or heavy exercise. Finally, advocate for yourself. Ask if a free PSA test or an MRI is appropriate before moving to a biopsy. Remember, this is a shared decision, and most healthcare providers are more than willing to discuss the options with you. So I hope this has been helpful. Yep, I hope that everybody got the message that PSA does not mean you have to panic. I mean, we all get the number and it's out of the normal, so we get scared. But, there's a lot of things that we do nowadays. The old days, I can tell you, it wasn't quite that way. You got a PSA, it was higher than 4, you were going to be ending up getting a biopsy. A lot of people went through biopsies to find out they did not have cancer. Now, I mean, it's not a terrible test, but it ain't an easy test either, folks. So don't get it, but unless you need it. But now, at least, hopefully, with these new tests, we're able to kind of decide who needs them, who doesn't need them. That's a key. So, hey, join us next week to learn more.
Incontinence and overactive bladder can significantly affect quality of life, causing sudden urgency, frequent bathroom trips, and even leakage that disrupts daily activities. In this episode of UroPatient, host Vic Senese breaks down how Altaviva therapy is used as a modern treatment option for patients struggling with these symptoms. Join us on June 27th at 10:30 a.m. Central Time to learn more.
Yeah, this is one of the newest treatments that have come out, is these electrostimulators that can help calm down those bladders that are firing off on their own. And as you saw in that first picture, sometimes you wet yourself, and boy, that's embarrassing if that happens. So this is something that's really neat. It's about the size of what you saw in that picture, and it's a small implant that's put into the ankle, actually. And you may say, well, it's nowhere near my bladder, but there's a nerve, and we'll talk about that next week about what that nerve is and how it can be affected by this very simple device. So tune in next week to learn more. Till then, be sure to like and subscribe to our show, and we'll see everybody next week on the UroPatient podcast.
From research updates to daily advice, Vic explains it all simple and precise. No question too small, no topic too wide. We're your urology partner, right by your side. UroPatient, tune in and see, paving your health for you and me. Knowledge is power, power. We make it clear every Saturday morning. The podcast is here.